Hi everyone, Dr. Sean here. Hope everyone's doing great. Well, today I'm going to be talking about when is it okay to actually fire a patient. So my job as a dental provider is to give the utmost care to my patients. However, sometimes enough is enough and it is time to fire that patient. Now, one of the reasons is if they refuse to pay the bill. So you can try as hard as you can in terms of offering payment plans, giving discounts, but if a patient is continuously not paying their bills, then it could be time to let them go. Another reason is if they're late or they're no-show to their appointment many times. Sometimes patients are late, sometimes they no-show, but when this is happening 3, 4, 5 times, then basically chair time that we're allotting these patients with the hygienist or the doctor is being lost because it's given to a patient that's just not showing up. So we're losing money and it's just not beneficial to the office. Another reason is if a patient is verbally abusive, whether it be to the doctor, to other patients, to the staff. This is something that we just don't take lightly. I did actually have one patient where all of a sudden they just started cursing at my manager and we had to just let them go. It was not okay to treat my staff like that or anybody like that, so it was very inappropriate. The next reason is just inappropriate behavior in general. Sometimes in terms of certain advances that are made on my staff as well. When the patient behaves in a way that makes my staff feel uncomfortable, whether it be flirting or touching, that's something that we just kind of nip in the bud and we just have to let the patient go. Another reason, which is not something that's very common, is when a patient steals from you. I haven't had a patient steal from me that I know of, but I've definitely heard from some of my colleagues that patients sometimes take certain dental material, composite, curing lights. I've actually heard that, so that's definitely a reason to let a patient go. Now, I would say the next reason is probably most important for me. It's about when a patient continuously does not accept necessary treatment. So I'm here trying to provide the utmost care to my patients. And when they need treatment that needs to be done due to having infections or abscesses or cavities, that's something that I'm here to take care of for them so their oral health stays at correct level. Now, however, there's some patients that continuously come in just for the 6-month recall and cleanings, and they still have that infection or the abscess, and it's just getting worse and worse and worse and worse. At some point, I have to just sit the patient down and say, hey, you can't keep coming in to just your cleaning. It's unethical for me to just do your cleaning when you have a pretty bad infection. So that's something where I kind of let the patient go and have to fire them or refer them out to another dentist. That's basically, it's our job as dental providers to offer the best possible treatment for our patients, to be patient, ethical, and caring. However, due to some of these reasons, sometimes enough is enough and it's just time to let your patient go and fire them. So there you go, guys. A little information about how and when to fire a patient. If you have any questions, let me know.